there, my name is Michelle Gray and I am a Public Policy Associate with the Minnesota Brain Injury Alliance, and I'm so pleased to be here today with my fellow colleagues as we prepare and get activated and excited about Disability Matters Day at the Capitol, which this year is Tuesday, March 18th. I hope you have it marked on your calendar. Anyway, I'm here with my colleagues. We wanted to bring some of the issues to you where you could prepare in advance of the day. So I'm going to be kicking it around here to some of the folks at the table so we can give you a little insight on the 3 key issues that we're working on this session, and also give you some information so that you can get prepared for our Day at the Capitol on March 18th. So I think I'd first like to kick it over to Rebecca Covington. She's our Executive Director of the Minnesota Consortium for Citizens with Disabilities. And Rebecca, I'd love for you to give us a little insight about what's happening at the Capitol this session, to give us a little lay of the land and what we can expect.
Sure, I'd be glad to, Michelle. Thanks so much for having me. Well, this is a short session this year, which means we have a lot to do in a shorter amount of time than we did last session. It's not a budget year this year. However, we do have a budget surplus of $1.23 billion. So there are a couple of spending items that we need to be ready to advocate on this session at the Capitol. Short session, we have a lot of work to do. Even though it's not a budget year, we have a lot of items that will be going through committees that do have fiscal notes attached, and we as advocates need to be ready to talk about those here at the Capitol. It's a very fast-paced session. A lot of committees are meeting from early in the morning till late at night to get through all the work that they need to do. Currently, we're talking about tax bills. House Ways and Means met this morning to receive an update from the MMB office about the February budget forecast and how they might look to spend the money that we have in the surplus. Now we know there's a lot of interest groups and individuals who are going to be advocating to their senators and their representatives about how we ought to deal with that budget surplus. There are a lot of voices that are talking about repealing taxes that were enacted last year, the business-to-business tax or the warehouse service tax, to name a few. But we as advocates know that there was a lot of work that was left undone last session, and a lot of items that we feel we need to bring forward to our elected officials to make sure that we get the best public policies enacted that we possibly can for the disability community. And we'll be talking about those as a panel to give you a little bit more information on what issues that you can advocate on at Disability Matters Day.
Fantastic. Thanks for giving us a little insight on what we can expect. So the next thing we'd like to do is just give you a little bit of more information about the 3 key policy priorities that the disability community is working on collectively at the Capitol this year. So first I'd like to turn it over to Jeff Nachbar, Public Policy Director at the Minnesota Brain Injury Alliance. And Jeff, if you could please give us a little bit more information about the Medical Assistance Income and Asset Standards bill that you're working on, as are the rest of us.
Sure, Michelle. Thank you very much for doing this. I'm glad to be here, and thank you all for coming to Disability Day at the Capitol. When we talk about Health and Human Services and some of the programs, I know can get really complex, and so we're trying to make this as simple as possible. You don't have to be an expert on the medical assistance program to come down here and advocate. You just need to be an expert on your own life. And one of our biggest concerns that we have in terms of the medical assistance program is how very poor they expect people to be in order to qualify for services. So when they did the health care reform, when the federal government did health care reform last year with the Affordable Care Act, made a lot of improvements, but left people with disabilities and senior citizens out of a lot of those improvements. And what we're talking about specifically this year is to do something about what's commonly known as the spend down. Now, in order to qualify for medical assistance, or MA or Medicaid, those are all the same names for the same program, different names for the same program. Take a look at how much income people have. And unfortunately, right now, if you make more than $1 over that standard, you must spend down all of your income until basically you're left as an individual with $719. And we just feel that that is an incredibly low standard, and we should not be forcing people into such deep poverty in order to get the help that they need. And in fact, it's not fair, because the standards for other individuals accessing the same programs are much higher. We know right now there are over 11,000 people with disabilities and senior citizens who are being required to live on $719 a month. And what we want to do is take some of that budget surplus to raise that standard and allow people to at least keep 100% of the federal poverty guideline, which right now is the equivalent of $958 a month. So let's use part of the state budget surplus to increase the MA and income standards and reduce the spend down so that people aren't driven so deep into poverty before they get any help. We really think that that's a good use of some of the surplus funds, and we'll be asking people to tell their stories about medical assistance and how important it is to their life when you come down to Disability Day at the Capitol.
Fantastic, great overview, Jeff.